Actions speak louder than words. And today, while we're talking about making children healthier, there's a way you can make it happen. The Royal Children's Hospital Foundation supports research, education and expertise that impacts generations of children. And with generous support from the Good Friday Appeal, together they make this podcast possible. Every single dollar is an investment in healthy children. Search the Royal Children's Hospital Foundation to show your support. Hi, I'm Dr Anthea Rhodes, paediatrician here at the RCH in Melbourne, and your host today on the Kids Health Info podcast. Well, winter is just round the corner, and that means so is the flu. And now is the time to be getting your child vaccinated with the flu vax. Lots of parents have questions, so here to talk to us about this today, we've got Dr Nigel Crawford, paediatrician here at the RCH and immunisation specialist. Welcome, Nigel.
Thanks for having me.
From the Royal Children's Hospital Melbourne, this is the Kids Health Info podcast.
So everyone's talking about flu vax at the moment because it's that time of year, but often parents just don't quite get around to getting it done for their kids or maybe aren't sure. What are some of the reasons that you come across?
I think sometimes people don't remember the timing of when it becomes, available. We have our routine immunisation schedule. Everyone knows to come in at 6 months, 12 months, 18 months, 4-year-olds for immunisation, but this is an annual vaccine that's generally available around April time. So it's sort of something we need to get into the calendar, have a reminder, and then make sure we can access, the immunisation. So certainly awareness and access to the flu vaccine are two issues for families.
And this year there's something new available. So tell us about that.
Yeah, so this year for the first time in Australia, we have access to an intranasal flu vaccine by the brand name of FluMist. So this is different to the intramuscular injection, which we've had previously. While it's new to Australia, it's not new internationally. It's been used in the Northern Hemisphere, particularly in the United States and in Europe, United Kingdom, for over 15 years. So lots of experience with this product, but it is a intranasal vaccine, which we think, particularly for children who might obviously wanting to avoid needles, it's a really good, option that we now have here in Australia.
So needle-free, and when you say intranasal?
So essentially it's in a syringe, but it's just 2 sprays up the nose. So it's one vaccine, but they give half up one nostril and half up the other. For all children from 2 to 17 years of age, this is an option for them as an alternative way to have the flu vaccine this year.
How can they actually access this? Obviously, we're here in Victoria, and I know it's a little bit different depending on where you live.
Yeah, so a lot of our vaccines, I mentioned the routine schedule, have our national immunisation program, of which vaccines are fully funded at a national level. Unfortunately, at this stage, the intranasal or FluMist vaccine's not on that program, so it is relying on different states having different programs, which can be a bit confusing, I know, for parents and families. So here in Victoria, it's not fully funded, unfortunately, but it is available on the private market.
So parents would have to pay, but they can actually get it from perhaps a chemist or the GP as long as their child's in that age group between 2 and 17 years in Victoria, and some other states they may actually be able to get it for free.
Yeah, so quite a few other states have funded programs, but it does vary a little bit by age.
So we'll pop some links to that in the show notes from the podcast today so people can have a look at what's relevant for them.
Yep.
So how is it different to what we might call the needle or the intramuscular vaccine? Does it work as well? Does it work the same way?
So it definitely works as well. So the key takeaway message is that we consider the two products equivalent. So whether you have the intramuscular injection or the intranasal, we know they both work as well in terms of their effectiveness for stopping particularly severe flu or hospitalised flu. They've both got 3 strains in there, so 2A and 1B, so they're exactly same constitution in terms of what's in the product. But as you can sort of alluded to, they do work a little bit differently. So the one that's given into the muscle tends to stimulate your whole immune system, particularly producing the antibody that helps prevent serious flu, where the one that's up the nose is triggering a different part of the immune system and stopping the virus from sort of getting in the first place. So it's providing a bit more sort of direct protection, to your upper airway and flu coming in. So different approaches, but I think the key take-home message for families is they both work, as effectively as each other.
Great. And is there anyone who can't have the new version of the vaccine up the nose?
So the new one, as mentioned, it's only licensed from 2 and over, where our intramuscular vaccine is for all children from 6 months of age. So the age cut-off's a little bit different. And because it's a live vaccine, it can cause some sort of upper respiratory tract symptoms. That might be a runny nose, a little bit of sneezing, sometimes a little bit of wheeze, in younger children. So that's why the age cutoff is a little bit different. And because it's a live attenuated vaccine, it can't be given to immunocompromised children. So those who might be on active therapy, for example, for childhood cancer or other underlying conditions, particularly in our hospital population here at RCH, there'll be quite a few who might be immunocompromised who we wouldn't recommend they have the intranasal vaccine, but they can talk to their doctor around that. And the other thing is severe asthma. So if you've obviously been in ICU with asthma, you might not be using this product in the last week or so. We would still look to administer the inactivated intramuscular vaccine. So a bit of nuance for those who've either been recently seriously unwell or immunocompromised, but recommend talking with your doctor around that if you're uncertain.
One of the things we commonly hear, and in fact nearly 50% of people on the RCH poll told us that they believe you can catch the flu from the flu vaccine. Is that true?
No, it's not possible to catch flu from the flu vaccine, and that's been a myth that's been around, as you alluded to, for a long time. So particularly with the inactivated or intramuscular vaccine that we've had for a long time, that's not a live virus, it's an inactivated vaccine. It's not possible to have or come down with influenza following that vaccination. So it'll have some potential common expected side effects, but not cause influenza-like illness.
So really it is a myth that the flu virus itself and getting unwell with influenza is not something that can happen as a result of the vaccine.
That's right. And the main thing that often happens is that we give the flu vaccine as the virus is starting to circulate.
So it's a coincidence.
Correct.
You got vaccinated and you also happen to pick up the flu at the same time.
Correct, that's
Understandable.
right.
So while we're talking about myths, what is another big myth that you'd like to bust? What do you see when it comes to flu that you think, it'd be really good to make sure parents know the truth on this?
Yeah, I think the main one is the sort of thought that sometimes circulates is that healthy children can't get severe influenza or don't end up being hospitalised. We had over 500 cases hospitalised flu in our hospital last year, and a lot of those children were healthy, particularly children that are under 5. So children under 5 are much more likely to get severe flu. And in actual fact, close to or sometimes higher rates than the over 65s. Yeah. So any grandparents listening will know they're always pretty good at going forward and getting their vaccine when they're 65 and over. It's an annual thing. Everyone sort of locks in with their GP. But for children under 5, the message hasn't been quite as strong. But the rates, when you look at it, are definitely as high, including in healthy children. So that kind of myth that particularly younger children don't get severe flu is one that we need to really counter and therefore encourage vaccination to minimise that risk.
Absolutely. And I know when I've seen patients here with really sick young children with the flu who have been previously healthy, they almost always say, I just had no idea that, healthy kids can get this sick from the flu.
Yeah.
So let's move on to some questions from the community now, Nigel. We've actually popped something up on social media, asked people, have you got questions? Let's put them to Nigel. So we're going to throw to our producer, Alicia, now with the first question.
This question's from Lucy. Lucy wants to know, do we really need to get vaccinated every year? Why is there no protection from previous flu illness or last year's vaccine?
So that's a really good question. I think the first thing to say is that flu is a really clever virus. It kind of shifts around every year. So we have a really close monitoring, both in the northern and southern hemisphere, what's happening with the flu. But that vaccine needs to be modified a little bit every year to take into account those changes. So the fact that it's moving means that it's not a stable virus that could just have one vaccine and protect you for 4 to 5 years, as some other vaccines obviously do. So therefore, we need to take into account those modifications and get a dose every year. You will have some protection that's continuous. So having it every year is actually a good thing because there will be a little bit of immune memory, and if the virus doesn't change too much, you will have some protection. But you do need that dose every 12 months to kind of make sure you're optimally protected and against the strains that are circulating, internationally. So therefore, having a dose every year is really important to maximise that protection and minimise the risk of hospitalisation, which is the key aim, as we talked about before.
Great. And one of the things that we hear a lot about now as well is what's the best time to get the flu vaccine? So sometimes people feel like they don't want to go too early because they want to make sure it lasts long enough.
Yes, the main message with that is really getting it as soon as you hear about it, it's available. So those are listening today and you hear about it, you should go forward and get the vaccine because it's very hard to predict when the season is going to start. We do have monitoring for that and there's different things where we can kind of make a prediction, but it's very hard to know exactly when the season's going to start. And we do still have cases circulating all year round. So a good example this year was that they had a strain that was circulating over the summer months and people when they're travelling. So rather than trying to predict the season, best just to have the vaccines when you first hear about it.
Yeah, great. And how long does that protection last once you've had the vaccine?
So we think it's around 3 to 4 months of sort of maximal protection. So there will be a little bit of waning, towards the end of the year, other components potentially. But again, it's that balance between having lots of doses versus maximising protection. So it's still, for majority, a single dose to have the vaccine. For younger children who are having the vaccine for the first time, particularly between those 6 months and 2 years of age, they should have 2 doses that first year, a month apart, to maximise their protection. That's just the intramuscular vaccine for them because they can't have the intranasal vaccine yet. But for that group, we are still recommending, in particular, 2 doses to maximise protection in that first season.
Great. Okay. And a couple of other questions on that. If people are travelling, you mentioned that we see influenza actually at all times of the year. What's your advice about that?
Yeah, so it's really good to think about having the vaccine before you travel. So if you haven't had the vaccine sort of in that season, then you can obviously have a dose, particularly if you do have a high risk condition or you're under 5. It's a fully funded vaccine. And we now have availability all year round. It used to have an expiry, particularly an activated vaccine that ended in December, but we've extended that out till March. There's really only now, a month of time often where there's no vaccine available. So definitely over the summer holidays, you can access a product. It is actually a shorter window for flu miss, so it is important to kind of know the timing of those vaccines, but you certainly can have one prior to travel. If you've already had one and you really want one before you travel at the end of the year, it is possible to obviously on the private market, potentially have another dose if you really want to maximise protection before you hop on a plane and travel overseas.
How long does it take from the day you get it done till you've got some protection?
Yeah, it's around 3 to 4 weeks. So people have sort of done lots of immunology and other testing around that, particularly with the inactivated vaccine. There's lots of research happening with the intranasal vaccine to work out, exactly the timing around that. But generally around 3 to 4 weeks, you'll have some measurable antibody and within a month have some good protection.
So another good reason to get in sort of at the start of the season, because by the time flu arrives, you still have to wait those few weeks before your vaccine's going to be working.
Correct.
Okay, on to the next question.
Kieran wants to know, does the flu vaccine work well enough to go to the hassle of having it?
It's around 50% protective from hospitalisation. So not as high as some vaccine preventable diseases, but also, as mentioned, it's a virus that's changing and moving and, hard to get a perfect match every year. So we think that level's definitely high enough. In terms of the hassle, I think that's something that you need to balance, again, the lifestyle and the opportunity versus the impact of having a child in hospital or really sick with influenza or coming up to their exams or other components, late in our winter. And if you are, maybe the flu mist or intranasal vaccine is an option for you because the hassle of having an injection and sometimes the issues that go with that, maybe an intranasal vaccine will help overcome some of those hassle factors.
Great advice. Thanks, Nigel. Next question.
And this question's from Naveen. Naveen wants to know, is it worth our whole family getting vaccinated?
So again, that's a really good question. And I do think it's a good idea for the whole family to be vaccinated. That's often a message we give families that we see in the hospital. Often the child we're seeing is higher risk, but one good way to minimise that child getting exposed to flu is the whole family minimising that potential risk and exposure. And essentially we've got vaccines across the life course that now protect everybody. So maternal vaccination, vaccine in pregnancy will protect the infant for the first 6 months. We have a fully funded vaccine program from 6 months to 5 years of age, special risk individuals over the whole of their lifespan, and then from 65 and over, again, grandparents in particular also can be vaccinated. Often workplaces provide vaccination, councils, other sessions will often provide vaccines to parents in particular who are interested as well as siblings. So I think the kind of concept of herd protection, not just of the herd as the broader population, but also the herd of your family or your close contacts and friends and families are a really good idea.
By having everyone protected, you're less likely to see the whole family go down one by one, which is, really difficult and awful experience that I know lots of people have actually had, unfortunately.
Yeah, no, that's right. And if you hear about it and want to get vaccinated, we talked before about how long it takes for the vaccine to work. So once it's sort of in the family, it's a hard thing to minimise, that exposure. So definitely the whole family being protected right at the start of winter is a great idea.
And so just before we wrap up, Nigel, I think it would be good to talk about some of the common side effects that people worry about. So what side effects are there from having the flu vaccine? You mentioned the mild, perhaps runny nose and congestion with the intranasal vaccine. What about with the traditional needle vaccine? Are there side effects that parents need to be aware of? What is it that people worry about?
So local reactions, so a bit of pain at the injection site is common. A temperature can often occur, particularly within 24, 48 hours. That is seen with both products, both intranasal and intramuscular can cause a bit of a temperature. So sort of they're probably the two main ones that we have reported from families. We do have some methods to do surveys for parents as they get the vaccines around the country to help us measure what those sort of reactions are compared to other years. So we're kind of monitoring closely for those common expected side effects.
So much really important information and advice there today, Nigel, and I'm sure parents listening thinking about flu ahead and when they should go and get their flu vaccine will be reassured with lots of that info today. Thank you so much for coming along to chat to us. Look forward to seeing you again.
No problems. Thanks for having me.
Information in this podcast is general in nature and is intended to support, not replace, discussions with your doctor or healthcare professional. If you have concerns about your child, please consult your local healthcare professional for individual advice. This podcast is recorded on the traditional lands of the Wurundjeri people of the Kulin Nation, and we pay respects to their elders. Kids Health Info is funded thanks to the support of the Royal Children's Hospital Good Friday Appeal.